Good afternoon, everyone. Good afternoon to our professor and to our dear classmates and colleagues. We would like to welcome you all to our program, which is Latch and Love, a breastfeeding support seminar. I am Gladys June A. Ohas, a medical doctor and a diplomate in the Philippine Obstetric Gynecological Society. I will be your MC for today. I am part of the Family and Community Program of the Breastfeeding Committee in Vicente Soto Memorial Medical Center. I would like to introduce our moderator for today. She is a fellow in the Philippine Obstetrics and Gynecologic Society and is also a medical specialist too in Vicente Soto Memorial Medical Center. She is one of the subgroup leads in the program for special population, which is the program for young parents, and is a member of the breastfeeding committee in Vicente Soto Memorial Medical Center. Please help me welcome Dr. Charlene Asuncion L. Lopez.
A pleasant morning to everyone. I am Dr. Laplana and I'm your moderator for today. For today, we have four topics to be discussed, all about breastfeeding. Our first speaker is Dr. Karen Chris H. Balbosa to discuss on building to nourish, understanding breast anatomy. And our second speaker is Dr. Yasmin S. Marave to discuss on nature's first superpower, why breastfeeding matters. And our third speaker is Dr. Maria Melissa Dublin to discuss on Latch On and Thrive On. And our last speaker is Dr. Arisha Avila to discuss on First Latch to Last Drop.
Good day, everyone, and welcome to Build to Nourish Understanding Breast Anatomy. In this session, we'll explore how the structure of the breast is perfectly designed to support milk production and breastfeeding, highlighting the key parts involved in nourishing the baby. On the outside of the breast is the areola, the dark area around the nipple. The baby needs a good portion of it in the mouth to feed effectively. Montgomery glands on the areola secrete oils to protect the skin and release a scent that helps the baby locate and recognize the mother. Inside the breast are fat and tissue that shape it, nerves that signal milk release and alveoli milk producing sacs. Muscles around each alveolus squeeze milk into the ducts leading to the nipple. The baby must compress ducts under the areola to extract milk. Blood vessels around the alveoli deliver nutrients for milk production. The first stages of milk production are controlled by hormones. During pregnancy, hormones help the breast grow, and after birth, pregnancy hormones drop and prolactin and oxytocin take over. Prolactin boosts milk production, which increases around 30 to 40 hours after delivery. Prolactin is the hormone that stimulates alveoli to produce milk, working after each feed to prepare milk for the next. It also promotes relaxation and sleepiness. Prolactin levels are highest in the first 2 hours after birth and at night, making nighttime breastfeeding especially effective. Oxytocin causes muscles around the alveoli to contract, pushing milk into the ducts for the baby to feed. This letdown reflex occurs multiple times during feeding and may feel different or less strong over time. Breast milk contains a feedback inhibitor or the FIL that slows milk production when the breast is full. Removing milk lowers FIL levels and increasing milk production. Milk supply depends on how much milk is removed, so efficient milk removal ensures plentiful supply.
Good day, I am Dr. Yasmin Marave, and my topic is about the importance of breastfeeding. Before the advent of formulas, mothers have no choice except to breastfeed. With the advent of milk formulas, mothers got confused whether to use breast milk or formula milk. So these are the advantages of breastfeeding. It reduces incidence of allergens, it is economical, and there's antibodies present, the stools of the babies are inoffensive, and the temperature of the breast milk is always ideal. Fresh milk never goes off, and there's emotional bonding between the baby and the mother, and it is easy once established. The breast milk is also digested easily, and it is immediately available, and it is nutritionally optimal, and gastroenteritis is greatly reduced. Breast milk is always in perfect condition for the baby. It contains most suitable protein and fats in right quantities. It contains more lactose. Breast milk has more of the good things that the babies need. It contains antibodies, white blood cells, and bifidus factor, which prevents infection. Colostrum, which is the first milk, is loaded with antibodies, WBCs, and growth factors. The long-term benefits includes less childhood obesity, better regulation of appetite, and there's reduced risk of chronic diseases like juvenile diabetes, childhood cancer, allergy, or asthma. The health benefits for the mother, it includes early return to pre-pregnancy weight, reduced risk of breast, ovarian, and endometrial cancer, and there's reduced risk of osteoporosis and bone fractures.
Go. Good day, everyone. I'm going to discuss one of the most important aspects for a successful breastfeeding, the correct attachment of the baby to the breast. It is essential for effective feeding, preventing discomfort for the mother, and ensuring the baby receives enough milk. In proper breastfeeding positioning, it is essential to ensure that the infant's head and body are aligned in a straight line to promote optimal feeding. The baby should be held close to the mother's body, which provide both security and comfort. Full body support is crucial to maintain a stable and relaxed posture for the infant. As the baby approaches the breast, the nose should be aligned with the nipple to facilitate an effective and comfortable latch. These are the most common breastfeeding positions. This is a good attachment. The baby's mouth is wide open, the lower lip is turned out, and the chin is touching the breast. More areola is seen above the baby's mouth than below. Seeing a lot of areola or a little of areola is not a reliable sign of good attachment. Some women have large areolas and some have small. It is more reliable to compare how much areola you see above and below the baby's mouth, if any is visible. If you see all the signs of good attachment, that the baby is well attached and can suckle effectively, and the mother is comfortable and not in pain. These are the results of poor attachment.
Breastfeeding is a cornerstone of child survival, nutrition, and development. Based on WHO UNICEF Baby Friendly Hospital Initiative, there are 10 evidence based steps that help establish and maintain breastfeeding success. Step 1, Policy. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. This ensures consistency and institutional support. All staff must know and apply it. Step 2, Staff training. Train all healthcare staff in skills necessary to implement this policy. All staff must have knowledge and skills regarding breastfeeding. This promotes coordinated care. Step 3, Inform pregnant women. Inform all pregnant women about the benefits and management of breastfeeding. Antenatal education is the key. This reduces fear and builds up confidence. Step 4, Care right after birth. Facilitate immediate and uninterrupted skin to skin contact and support mothers to initiate breastfeeding within an hour of birth. This promotes bonding and early milk production. Step 5, Support mothers. Show mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. Proper latching techniques. This expresses milk when needed. Step 6, Supplementing. Give newborn infants no food or drink other than breast milk unless medically indicated. Avoid unnecessary supplementation. This protects the gut and promotes supply. Step 7, Rooming in. Practice rooming in to allow mothers and infants to remain together 24 hours a day. This encourages bonding and increases feeding frequency. Step 8, responsive feeding. Encourage breastfeeding on demand. Feed when baby shows signs of hunger. Avoid scheduled feeds. Step 9, no artificial nipples. Give no pacifiers or artificial nipples to breastfeeding infants. This prevents nipple confusion and encourages effective sucking. Step 10, support groups. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge. This encourages long term success and builds a support network. These 10 steps help hospitals support mothers in initiating and sustaining breastfeeding. Every health facility should implement them for optimal infant health.
So, thank you, Dr. Lopez, for moderating today's lectures, and thank you to all our lecturers for today's discussion. In summary, we would like to start with a discussion on the breast anatomy, wherein Dr. Balbosa was really able to give you an illustration of the parts of the breast and how breast production is done. So in breast production, of course, we have prolactin for production of milk and oxytocin for milk ejection. Then we also have the feedback inhibitor of lactation, wherein there is only milk production if there is milk ejection. So why are we discussing breastfeeding extensively? We are discussing it because breast milk is very important and very advantageous for the babies. Why? One of the advantages would include reducing incidence of allergens. Others would include being more practical, being more easily available, easily digestible. It has more natural antibodies that can fight off infection and is very practical to use since it is free. Also, it is nutritionally optimal. And for the mothers, it is also very advantageous because there is early return to pre-pregnancy weight. For the long-term benefits of using the breastfeeding, this would include lesser childhood obesity, better regulation of appetite, reduced risk of chronic diseases, and it also helps lower cholesterol as adults when they grow up. So when we do latch on, we also consider having the proper breastfeeding position. In proper breastfeeding position, we need to ensure that the baby's head and body are in line. The babies are held close to their mother's body. The baby's whole body should also be well supported. In proper breastfeeding, there should be correct attachment. So in correct attachment, we consider 4 things. First, more areola is seen on top of the baby's upper lip. Second, the baby's mouth should be wide open. Third, the lower lip is turned outwards. And fourth, the baby's chin should touch the breast. Other than this, there is poor attachment, which will lead to pain in the nipples and damage to the nipples, breast engorgement, unsatisfied baby, which causes more stress to both baby and mother. Lastly, Dr. Holganza Avila was able to discuss about the 10 steps in breastfeeding that make it successful. So first would be hospital policies, meaning we support our breastfeeding mothers by not promoting infant formula and use of bottles or teats. Second, we have staff competency, which will allow our trained personnel and our trained staff to support breastfeeding mothers. Third, we have antenatal care. So even during prenatal, we already teach our mothers how to feed their babies. Fourth would be care right after birth. So in care right after birth, we do immediate skin-to-skin contact so that mothers and babies are able to bond and that babies are able to latch on to their mother. Fifth is supporting mothers with breastfeeding. So we do checking of our positioning and correct attachment and suckling of the baby when the mother is breastfeeding. Next is supplementing. So we only give breast milk unless there is a medical reason to add to it or to add another supplement to it. Seventh step would be rooming in. So we all know that there should be immediate skin-to-skin contact, and early rooming in would mean early breastfeeding and early connection between mother and baby. so that there is more emotional bonding. Eighth is the responsive breastfeeding or responsive feeding, wherein mothers are taught when their babies are hungry. Nine would be counseling the mothers on the usage and risk of our bottles, our teats, and pacifiers. And lastly is the discharge. So we don't just support mothers as inpatients, we also support them as outpatients by referring them to the proper health professionals or healthcare workers in their communities so that there is continuity of breastfeeding support. Thank you. That is all for our summary for all the lectures for today.